Good morning, everybody. This is Dr. Raghavendra here. I'm Director of Central Council for Research in Yoga and Naturopathy, Ministry of Ayush, Government of India. Greetings to everyone for being here on the second day of event. Yesterday's event went on very well, I heard. And today we're going to have the culmination of all the sessions, the talks of all the speakers, to the panel discussion. And it is an honor to invite all my colleagues from the other part of the globe, Dr. Dr. Karen Mustian, and who's from the University of Rochester. She's one of the lead researchers on yoga in oncology, especially in breast cancer patients. She's done some phenomenal work in the area of yoga and fatigue. And she also had several chairs and several committees in NCI, as well as in Society for Integrative Oncology, and as well as in supporting MASCC. So I welcome Dr. Karen Mustian, who is here, who has shared a valuable and busy time to be with us and share her thoughts about the use of yoga in cancer. Welcome, Dr. Karen Mustian. And secondly, I would also like to welcome Dr. Santosh Rao, who is an hemato-oncologist from Banner Health Cancer Foundation, University of Arizona. He's from Phoenix, and he's a very, very active member of Society for Integrative Oncology. And he was also the president of, he was the ex-president of Society for Integrative Oncology. And I take this opportunity to welcome him here to this particular event. We also have Dr. John Kepner, who's a member of the IIYT. We have Dr. Satbir Khalsa, who is from Harvard University, Brigham's and Women's Health Hospital. He's one of the very important, passionate researchers on yoga, on yoga, and has been traveling all across the globe. And you can see him in most of the meetings, wherever there is some meeting on yoga here. And he's here to share his views and thoughts about how he's planning to take yoga forward in India as well. So welcome Dr. Satbir Khalsa as well to this floor. And I also have with me my colleague, Dr. Vajiraja, and he's a senior research officer at Central Council for Research in Yoga and Naturopathy. He has also done some phenomenal work in the role of yoga in oncology. His PhD thesis was on cancer patients, integrating yoga into oncology during radiotherapy. And I also see Pro Julin, who's a student of Karen Mustian, who I happened to meet about 2 years back at SCRSA. And she's a very active researcher and a lead researcher working with Dr. Karen Mustian. So also welcome her. She's on the attendee list, but. And is there anybody else I have missed out?
I think you covered all.
Yeah. And also we have Akshay here to moderate the session. Akshay, over to you. We can start off with Dr. Karen Mustian, I believe.
Okay, great. Looking forward to a lecture by Dr. Karen Mustian. Thank you, Dr. Raghavendra, for a very elaborate introduction to each of the distinguished speakers. So I think we'll get going right to business of having a good discussion on different topics of cancer and yoga and palliative care, and then have a discussion and kind of trying to have a consensus statement or a declaration at the end of the panel discussion. Over to you, Dr. Karen Mustian.
So thank you very much for having me here. This is late Saturday night in the United States, where I'm at in New York right now. But I can't think of anything better to do on a Saturday night than join all of my amazing colleagues and all of the attendees from around the globe at this special event. So I am a professor in the Department of Surgery, and I work with cancer patients and survivors in our Cancer Institute here at the University of Rochester in New York. And, one of the things I would like to share with the group, in case you missed my talk, is really just a couple of seminal findings from 2 very large randomized clinical trials that we've conducted here in Rochester. Actually, we led them in Rochester, but we recruited cancer survivors from all around the United States to participate in these 2 trials. Our first trial actually compared our yoga intervention to standard survivorship care, which at the time, standard survivorship care pretty much meant that patients in our country would finish their chemotherapy and radiation therapy, and then they would graduate from therapy and kind of go off on their own with regular medical follow-ups. And we didn't have much formal supportive care in place for them to manage any of the side effects and toxicities that they would experience during that time. And in a second trial that we just recently completed, we recruited 720 survivors from around the country. And we presented some of the initial results of that work just recently at a large conference here in the United States. And the main findings that we know from our data from both trials so far is that if our participants will actually do 75 minutes of yoga 2 times a week, and this yoga does not have to be super vigorous or strenuous. It doesn't have to be in a hot room or anything like that. It can be very gentle hatha yoga. And in fact, it can actually include restorative yoga. And if they'll do it 2 times a week for 75 minutes, they will actually obtain, they can cure their insomnia that they might be experiencing. They will reduce their fatigue. They can decrease their anxiety, improve their mood. And for women who are breast cancer survivors who are taking aromatase inhibitors and tamoxifen, they can significantly reduce their arthralgias and the pain that they experience. And our participants also showed that they can improve their ability to do their normal activities of daily living and their overall quality of life. So our take-home message clearly is that yoga is very effective. And we encourage all of our survivors, as well as our oncologists and our physicians, to talk to patients and to do yoga and incorporate it as a practice into their everyday life. And that's really my take-home message for everyone at this point. Thank you.
Thank you, Karen Mustian, for setting the scene. And so we have questions about what are the challenges. Just give me a minute. Yeah, what are the challenges in integrating yoga and oncology, which is very important, as also enumerated by your brief talk. And to understand the role of yoga in survivorship, role of yoga in chemotherapy, and in symptom management, also in palliative care. So I'll now invite Dr. Santosh Rao to give his presentation, share his thoughts. Dr. Santosh Rao?
Yeah, I'm here. I don't have a presentation as such.
Yeah, you can just chat, we'll listen. Yeah.
So as Dr. Rao had mentioned, I'm a medical oncologist in the United States. I have been, a practitioner of yoga and done some research in yoga for, 25 years myself. So I have great respect for yoga. I think yoga has become very mainstream, but it also encompasses many different things. I think from an Indian perspective, we think of yoga in many different ways, but part of it is lifestyle, and part of it is part of our spiritual growth. Whereas in the US, it can mean those things as well, but for many people, it's just an exercise, And so I think that's one thing that has to be put in perspective, is how is somebody approaching it? What are all the things they expect to get out of yoga practice? And what do we mean by it? Obviously, as an oncologist, many of our patients have to modify what they do. I think in terms of my criticisms, if there are any, it's basically how broad yoga is. I know that Lorenzo Cohen, I don't know if he's on, but he has taken a very specific, for example, yoga from Vivekananda Kendra. And I think that that's very important. People who are doing research, good research, you have to have a sense of what exactly your participants are doing, because otherwise it can become a very vague thing. For some people it's lying in shavasana, for some people it's doing active postures, etc. And as for those of us who've done yoga, we know it's personal. The other thing that is a kind of a criticism for me in terms of how it's practiced in the US, I think I mentioned this on our phone call, I don't think people pay attention to the circadian rhythm. You know, if you go to a cancer center, or even if you're part of a research study, I find it very interesting that sometimes these people are coming in at 2 in the afternoon, 10 in the morning. It's totally different. You know, that's not how I do yoga. I do it, you know, when I'm supposed to, in the morning or after, you know, before I eat dinner. I don't do it just randomly. So I'm curious to hear what other people's thoughts are, but I feel like those are the types of things that we need to study more. And if we're going to really implement this to have the full effect of yoga that I think we need to have, where you're getting somebody back into being grounded and self-healing and those kind of things, and then work that into research. And then the last thing is Raghavendra Rao has worked very much on biomarkers. I do think that's important also when it comes to research.
Thank you, Dr. Rao. Is that what you wanted to say? You have anything else to add?
No, I mean,
Yeah.
that's
So we'll carry on. Yeah. Thanks, Dr. Rao, for labeling and for flagging the issue of the vagueness as it exists. So need for more structuring. And you very nicely pointed out the deficiency in our research work on circadian rhythms in yoga, which apparently has some implications for pain management also. What do you think, Dr. Raghavendra Rao? Dr. Raghavendra Rao is just started the directorship of CCRYN, one of the active wings of Ministry of Ayush, and is an advocate for yoga protocols. And I think that can put the vagueness into more structured form, more acceptable, more easy to administer, and also to carry out randomized controlled trials. Because when you have something in a format, it's easy to compare. So over to you, Dr. Raghavendra Rao. You're well published, you worked in cancer, and you've been in Delhi, stuck through the lockdown outside your family, without now probably in touch with your family, back with you. What do you think? Where do we stand with the last two speakers, and what are your thoughts? And how are we moving forward with funding, with any new roadmap in place for meeting the challenges of integrating yoga and oncology, or survivorship, on pain management, or whatever? Over to you, Dr. Raghavendra Rao.
Just to recapitulate the last two speakers, there was a phenomenal work done by Dr. Karen M Mustian as well as Dr. Santosh Rao. Dr. Santosh Rao was very, very modest. He has a very, very big integrative medicine department, and he runs it very methodically with a lot of psychologists. He has acupuncturists, he has massage therapists, he has yoga therapists. He has a whole ambit of a team which does a lot of phenomenal work with cancer patients. And Santosh Rao, this is a very fitting example of integrative medicine which can happen in oncology, which unfortunately I'm not seeing anywhere in India. Okay. But what I would like to tell about Dr. Santosh Rao as well as Dr. Karen Mustian's work, if you look at the kind of work which has been done by Dr. Karen Mustian, it's a very large multicentric randomized controlled trial, which you often don't see in India. The reason being that in India, we are still not open to a multicentric kind of trial. We're not open to that kind of a grant amount of money, which is given for doing large trials. So most of the grant money is now poured up for doing small trials, which are, just a pilot kind of trial with about 50, 60 sample size, which are only giving you some sort of a hypothetical conclusion, just takes you to an observational finding that this could be a very good hypothesis to do further research on, but cannot give you any conclusive findings. I think this is a very stark difference between the way US operates, the way India operates. Therefore, I'm not surprised when Dr. Santosh Rao said yoga has become mainstream there in US, whereas unfortunately it's still not a mainstream medicine in India. Okay, the reason also being that in India the oncologists are not aware of these findings which are already happening in US. Neither these kind of studies are also happening in India. It's only late now that we have just started off some big studies. So because of the funding issues and other things, what we have decided is to have partnership with other granting agencies like Indian Council for Medical Research. So we recently had a discussion on this. We brought up a combined grant proposal, Yoga for Heart Failure, which was mooted by PHFI. CCRYN also pitched in, and both of us together are doing a very big randomized multicentric trial for heart failure for in 25 centers across India. So this is a sign of partnership and collaboration. This has not happened in India before, and now we are starting to do something of this sort. So it is high time that we also start doing large multicentric studies and try to make funding available for such kind of a intervention. This is one thing. Second thing is, as Dr. Santosh Rao talked about, circadian rhythms and doing yoga at different times and having a specific school or thought of yoga and trying to use yoga in a proper sense is very, very important. I often see sort of a lot of researchers from my own fraternity in AIMS and other places. They just hire a yoga instructor and do some sort of yoga. And at the end of the program, they don't find anything. That's because they're not given a good thought about the yoga intervention program at all. They don't know what yoga can be done to the patients. Often I see their yoga intervention is about 1.5 hours, which is practically not feasible. Okay, so we need to be very, very clear on what is our goal and how do we achieve this goal. And a lot of thought has to also go into these kind of yoga interventions which you want to give to the patients. And second thing about circadian rhythms, a lot of things have, a lot of developments have happened in this area. So even people are also mooting the idea of giving chemotherapy, okay, at the different time points of the day or in the night. They're talking about giving chemotherapy in the early morning, okay. So just like sir was talking about giving yoga in the early morning. So this is also called as chronobiology or the chronotherapy, okay. And this is also now catching up with some researchers trying to work on this aspect of circadian rhythms. They are trying to see whether the bioavailability of the drug or the effect of chemotherapy is much better when you give it in the morning as compared to evening. A lot of studies are going on, and we need to do similar kind of studies with yoga as well. And why I say yoga would be very, very useful in the morning is also for the reason you have cortisol peaks. It peaks early morning after your waking time. So this is where you can reduce your cortisol by bringing about a relaxation response. So if you can reduce the cortisol peak in the morning, then your cortisol levels may be stable throughout the day. So it makes you better. It makes you more feel refreshed. It makes you able to take care of these stressful situations. This is a hypothesis. We still don't know about this. So it's interesting to also evaluate and try to see patients who do the yoga in the early morning versus patients who do the yoga in the evening time or other times of the day. Okay, but it's a very interesting question. But to do it in a research setting is a very big challenge for all of us. So right now I think we have given a dose of virtual yoga to most of the patients. So now since the social distancing norms have come up and because of this COVID pandemic, we don't have yoga classes which are open anywhere in the country. So most of them are now taking up to online classes. I hope that becomes a boon for us researchers because if this becomes popular, it will be very easy for us to deliver the yoga intervention to the patients. Though we don't know whether it's going to be the same as an instructor doing a yoga, a one-to-one yoga session with the instructor. We really don't know about that, but that's for us to see how to do a research on that as well. But nevertheless, it gives us a good time to the patients at the time of our choosing, and these kind of studies can definitely be done with that kind of a paradigm. So these are some of my thoughts on this. But coming to India, I just want to throw a small light on this. The challenges are many as far as India is concerned because you have a lot of disparity in the treatment, access to care, okay, and you can see many of them pay out of their pocket expenses. You have a lot of poor people sitting in long queues, and you have these cancer centers not spread across India. It is mostly in the metropolitan cities, the capital cities of all the states. People often have to travel long distances, leave their homes, come to the cancer center in the metropolitan city, and stay there for about 5 or 6 months to complete the treatment and then go back. One is access to care. Second one, lack of affordability of all the cancer medications. Though government has done a lot to help in giving subsidized cancer care to the population, still some of the important drugs which you see in US is out of reach of the common man in India. Okay. Third, yeah. The third one, which I want to tell is when this is the situation, people are more concerned about the financial distress, concerned about access to care and other things. Having them to participate in research is often a difficult prospect. Okay, because to get them on time to the hospital, to get them to come on regular follow-ups is also a problem. To do a study on fellowship in India is quite very, very difficult. though I tried to do one study on this, but I was not so happy with that particular study compared to the study which I could do on patients who are on treatment, because I had a good follow-up of patients who came for treatment to the hospital rather than trying to follow up the patients during the survivorship period. Okay, so that was a big challenge for all of us. So in India, the scenario is different. So we need to really, when you want to think about doing a study in India, it has to be taught differently compared to what is being done in US. Okay, it's not an easy game here at all, because adherence is a very, very important issue for yoga interventions, and unless you have a proper adherence, it is very, very difficult. So what we have done now is, Dr. Karen and Dr. Santosh, we have started something on small innovative things. We have started developing what is called as a smart yoga mat, which can measure relaxation response, which can measure heart rate variability. So, okay, so the patient lies on the mat, does the yoga practice. So we have a mobile app called as Dozy. So patient uses Dozy and does the yoga relaxation technique on that. And post relaxation, we also know what is the response. Okay, we'll know how much heart rate has come down by, what is the heart rate variability index of this patient. Does he have a parasympathetic response following a relaxation technique or following a yoga program? So we're able to do that. So we have developed that kind of innovation with IIT Mumbai, and now we are slowly launching this in the cardiology project. We already started doing this in the COVID-19 projects at AIMS Jajjar and AIMS Delhi, as well as AIMS Rishikesh. We are starting now. So we're already piloting that in Rajiv Gandhi Multi-Speciality Hospital. So we need to really innovate and develop our strategies in these times, so that we are able to deliver a proper tele-yoga intervention, online yoga intervention. At the same time, also monitor the quality of the intervention through certain technology which can be done, which can be adopted. Okay, over to you, Akshay.
Thank you, Dr. Raghavendra, for pointing out the importance of funding multicentric trials and the yoga mats. So before we go to Dr. Sadbir and Dr. John Kapner, just want to take a change in track a little bit to see if Karen and Dr. Santosh may be thinking of reacting to what Dr. Raghavendra said. Do you want to just react on the multicentric trials? Should we have a focus on any particular kind of a multicentric trial, a particular kind of cancer, or a pre-cancer thing to generate evidence in favor of the effect of yoga? And or Karen might want to tell how the patients might like to see what they demand as a output from a particular kind of a randomized control trial. If you have any quick thoughts, you can add. Otherwise, we can go to Dr. Sadbir. Just kind of an interim analysis of what Dr. Karen, Dr. Santosh Rao, and what Dr. Raghavendra Rao said.
I mean, I like the heart rate variability and those kind of things that you can measure using technology. I think that's very impactful. And I think the things that have been done that are going in the right direction are looking at symptom management, like yoga for sleep, pain management. Those are the kind of things that have a real impact and have led to it, like I said, being somewhat mainstream in the US. So I think continuation of those kind of impactful studies are really important.
Sure. So heart rate variability, circadian rhythms, the importance of funding in India, and the multicentric trials. So maybe we'll come back to Dr. Raghavendra. Thank you, Dr. Rao. And we'll come back to Dr. Raghavendra to ask what the national educational policy just rolled out in India, what it has in store for addressing some of these questions. But before we do that, we'll move to Dr. Sadbir Khalsa, a distinguished colleague at the Harvard Medical School, and has a lot of work in molecular aspects of yoga and in general, spreading the awareness about yoga, also mentoring a lot of students from PhDs to even the medical graduates. He keeps appearing at different meetings and conferences. Please share your thoughts, Dr. Sadbir.
Okay, thank you very much. And I want to thank the organizers for the honor of being able to participate in the panel. I gave a presentation yesterday that sort of gave a broad overview of the research. But before I start my presentation, I want to go ahead and share my screen. I have a brief PowerPoint. I need to state at the outset that I actually have not conducted research on yoga for cancer, and I'm also not a clinician, certainly not an oncologist. However, I've practiced yoga for over 45 years, and I've been doing yoga research full time for the past 20 years. So I have a sense of what the meaning of the panel was, the topic, which was and I actually to address comments on the topic that was behind this. And this is a strong that people for cancer patients, say 50 years ago. So in a sense, we were people, you know, lagging behind us. Like, it also conveys the lag behind competition. I like to put behind us the whole idea of alternative medicine is being rejected by many of us in the field of integrative medicine. We like to talk about complementary medicine, that we start to validate processes and therefore it can be incorporated into modern medicine. The whole idea is not ideal. I like I was just saying that the for progress into cancer care. And so I'd like to address that topic from a broader perspective. And this slide really conveys what I see are two areas that are really critical for yoga, cancer models. And of course, the first thing is really research. We absolutely need the research studies that have been done and will be done on yoga for cancer patients. We need quality randomized control trials on both the efficacy and we need to know that yoga can be good for fatigue, that it can be good for nausea, that it can be good for stress and insomnia.
May I?
Those are efficacy trials.
Very briefly.
Yes.
Sorry about that. In the last 2 minutes, there was an interruption of your voice, apparently due to an internet connection, maybe at your end or somewhere, we don't know. So maybe just kind of give an interim of what you said in the last 2-3 minutes.
Okay, so this slide really portrays a sort of a broader view of where we are with the perspective of the implementation of yoga for cancer. There's two broad areas to address when we talk about this moving forward. And one of these is research. And the research is really critical. We need very high quality and rigorous research, the so-called randomized controlled trials, which are the gold standard to look at studies of yoga for cancer patients, whether it's for the stress, for the anxiety, whether it's for the side effects of treatment, the nausea or the so-called chemo brain, the cognitive problems. It's not totally all the treatments work to give them confidence in the treatment. So we need many of these trials. And then we also need, as Dr. Rao mentioned, large multi-site pragmatic efficacy trials. These are so-called phase 3 trials. We're now bringing to the studies in large populations, really finally nailed down. And what all this research does is it's critical mass. And that critical mass of research is what makes it allows policy changes to place. We have justification of cancer patients. Other research is really important, so-called hospital research. And this does is it tells us that yoga is not only efficacious, but it's cost effective. It's not more expensive. In fact, it can be less expensive than many of the other treatments that are used for symptoms for cancer patients. So I think research is one area, and that is critical. And then of course, Dr. Rao mentioned funding, and we can't do research without funding. So funding has to be there for the research to happen. Now, even when we have the research, then there's what we call translation. And this is what's happening in medicine at the sort of the policy level, at the leadership level. And these are factors that are, controlled by socioeconomics and politics in any medical system. And one thing that needs to happen is that when you have once you have the research, you need to educate. You need to educate the physicians, the healthcare students, and the general public about the research that's been done, so that medical students can understand that there are options for yoga for treatment cancer based upon validated studies. Another area that's important is reimbursement for yoga interventions. This is very difficult to do for patients who can't afford private yoga classes or the chair yoga that's necessary. Reimbursement is another factor that plays into this. And then finally, I think what's also important, in particular in cancer, is that we know that almost 50% of cancer is actually preventable. And yoga actually addresses a lot of the risk factors for cancer. And so I think the implementation of prevention as a priority in modern medicine is very important. It's important to try and prevent cancer as opposed to just trying to treat it once it's arrived. So I think there should be efforts in that direction. So I just wanted to share a couple of things that I found on the internet from sort of governmental and societal organizations that really reflect some of the sort of the translation of bringing this idea of yoga for cancer into mainstream medicine. And one of these is in the United States, we have the National Institutes of Health, which is funding a substantial amount of biomedical research in modern medicine, and this is the National Cancer Institute. And if you go to that site, you can see actually sections on this site, web pages dedicated to talking about how yoga can be beneficial for cancer patients. And this is based upon the research that's been done. Research on the panelists on this session, Karen Mustian, Lorenzo, Cohen, other colleagues have conducted research that show that yoga has benefit for a number of symptoms, and that is the basis for sort of governmental agencies to start, educating the public and providing this as an option. Another organization, of course, is the American Cancer Society, and if you go on their website and search for yoga, indeed, you will find it there. It talks about yoga, it describes it, it talks about the efficacy of it, and so here again, you have education of the public as determined by and based upon the research that's been published. Another organization is Canadian Cancer Society. And here again, there's a whole description of yoga and its possible benefits and how this can be used for cancer patients. So this is one way that that yoga can be implemented. And I think it's up to the yoga researchers to really push for this, to really get the research out there, to publicize it, and to work with their societies, their oncology societies, to make this known not only to patients, but also to oncologists as an option. And this is another way to do this. And this is more for oncologists and for colleagues. And this is to create policy or consensus statements. And this is done in many fields where you build up a body of research and then you bring together a number of colleagues who work in this area and create these policy statements. And what you can see in the authorship here, this is a lot of authors. In fact, both Karen Mustian and Lorenzo Cohen are co-authors on this particular policy statement from the American Society for Clinical Oncology. And in that policy statement, what they do is they talk about the efficacy of these and they rate the efficacy as in terms of grades as to how effective this is based upon the research evidence. So quoting from this paper that was published in the Journal of Clinical Oncology, music therapy, meditation, stress management, and yoga are recommended for anxiety, stress reduction. Meditation, relaxation, yoga, massage, and music therapy are recommended for depression, mood disorders. And then meditation and yoga are recommended to improve quality of life. So here you have policy statements that can be read by oncologists themselves who can then share these recommendations with their patients. Now, this is from Europe. This is another practice guidelines, another consensus statement. And these are from European researchers. And here you can see the recommendations that yoga could be an option to improve cancer survivor quality of life. So again, and these are all rated based upon grades of the quality of the research that's been published. So this is an important way for the research to be then translated into mainstream medical care. And I think it's important to also talk about what's happening in India. Dr. Rao mentioned that there's very little yoga research on cancer in India, and I think that's true. My search on the internet, I found this page on the Indian Cancer Society. I could not find anything about yoga, but what was really ironic was that in a section on psychosocial rehabilitation on this website, they were talking about therapeutic recreation therapy like visual imagery, relaxation techniques, and dance movement therapy. And the ironic thing is here that these practices are basically Western type relaxation practices. And we have a very good, strong body of research on yoga shows that it's an excellent stress management, emotion management strategy. And yet it is not even listed in this list. What we have is an Indian society referencing primarily Western relaxation techniques. So I think there's a long way to go for the recognition of the benefits of yoga for cancer in India. And I want to end with one slide that is basically suggesting what we should really be avoiding. And this is from a number of media reports that came out from statements that were made in 2016, and a number of Indian reports from Union Express, and the top is this: yoga can cure cancer. Government may have proof for you. This is from the Minister of Youth. Start to use language like yoga cure cancer. The problem here is that just start going and have verified in their minds that yoga is credible, and everyone is basically claiming these wild claims, and that really credits there. So I think be very careful about how we publicize the whole idea of what the research is showing. And the research is really showing that yoga is good for the symptoms, many of the symptoms that cancer patients have. And the idea that yoga can cure cancer really needs to be put in its proper perspective.
Dr. Sadhvi,
so
we
those are my
lost you.
comments.
Yeah, thank you for that presentation, but we again lost you for that last slide. Just, were you trying to say that the claims such as this one in the Indian Express shouldn't be made? Your voice was breaking up.
Yes. So this was a number of articles that came out in the media in India in 2016. A number of newspapers. The title of this particular news article was "Yoga Can Cure Cancer. Government may have proof in a year." Minister of Ayush was making this claim, and this was quoted by him. And I think this is something that we need to be very careful about. Statements like yoga can cure cancer will be viewed by conventional oncologists as really confirming that we are a bunch of nuts, that we are really sort of out in the left field, that we are making these huge claims and that this is not a credible area. And this can be actually a step backwards for us. So I think we need to be really careful how we talk about the benefits of yoga for cancer and really be accurate when we describe our research studies. So I think I'll end there. Thank you.
Thank you, Dr. Sadhvi, for flagging these issues, and especially the news articles. That we really have to be careful, but we also have to find solutions for this. And I look at it from a perspective of publication. As of now, we didn't have a single case report journal. You know, this particular article points out to 1 or 2 cases who presumably were cured by cancer, and they can actually find venue in a journal which is dedicated to case reports, just like the one that we started here on that board. And the other issue you mentioned was the implementation of prevention. I really like that. The prevention of implementation can be taken to the research level by what I'm not a cancer researcher, but what I really like is to design studies that are looking at the conversion of pre-cancer or any of the pre-diseases into full-blown disease, and generate data either through randomized controlled trials or multinational trials. And that will give a very good data to convince the policymakers, as you pointed out, how to bring it to ground. Those kind of research will be the real hammer that it can really prevent. If we can show that the conversion from pre-cancer to cancer actually got halted. Well, we'll move to the last, but the most important speaker. We kept him at the last because Dr. Kepner can have the opportunity to sum up and have a new perspective which none of the distinguished speakers covered. He is the Executive Director of the International Association of Yoga Therapy, And interestingly, he comes from the finance background. He has an economics and finance background, so he can bring in the cost effectiveness, maybe, to the whole discourse. But the most interesting part is his interview he gave to Rita Triger, and he wisely said the following: injury or sickness can be a great teacher and motivator. Yoga can also be beneficial when somebody has lost hope and is dying. That's quite true. Think of a person who has been diagnosed with cancer and the chemo is not working. That person is wrestling with lots of things, and yoga can help in the process of accepting the inevitable. Very rightly said, Dr. Kapner. We are waiting to hear from you. All eyes and ears to you. Over to you. Welcome.
Okay. So thank you very much. I'm so appreciative to be here with this distinguished group. I'm going to be brief and talking about some things from perhaps a different perspective. You know, I'm not a researcher and I'm not a clinical oncologist or anything. So I want to speak from the perspective of the yoga therapist and our association, which is trying to really better integrate yoga into cancer care. Okay, so let's see. One of the questions we had was, why is yoga and Ayurveda lagging behind coming into integrative medicine? And we'll talk about particularly with cancer. So this is a slide that I gave earlier in a previous presentation. As all of you have said, and for example, as Satbir, research is so important. So you guys know much more about that than me. But some of the researchers tell me there's actually enough research to to support yoga in cancer care. What's really missing is the financing or the reimbursement. I want to get to that. But some of the things that we need, from at least from my perspective, our perspective, is professional education of yoga therapists. So IYT has spent 10 years developing standards for the training of yoga therapists, accrediting yoga therapist training program, credentialing yoga therapists. IYT has 4,000 already, and across the world in the Western Association, we have over 5,000 certified yoga therapists. So that's all part of their professional credentials. As you guys know, in healthcare, credentials are very important. And we've worked for years to develop a credible credential for yoga therapists. And that's just the start. Down the line, we have some goals to have postgraduate education in yoga for cancer care. Post what we call CIAYT, which is our credential. So if we're going to talk about financing, as Satbir and other people talked about, which I often called health insurance, you need the research, you need the professional education, you need the professional credentials, and then you also need the education of the public, as some of you have said. You need to educate the public to see the difference between, I'm going to call it a typical yoga class, which is, as some person said, often an exercise class, a vinyasa class or something like that, taught by typically for young, fit people, which is not appropriate for people undergoing cancer care. So it's education of both the public and other healthcare professions. Now, IYT actually has a lot of material, which I could share later, on educating the public and educating healthcare professionals. And part of that is citing the research that all of you have done, okay? The last thing, which is so important to all of our yoga therapists, is professional employment. If they're going to invest so much education, so much time and money into education as a yoga therapist, which according to our standards is sort of like an early professional master's degree, it takes 2 years, they have to be professionally employed. And the whole healthcare system is not generally well set up to professionally employ yoga therapists, okay? So those are our perspective of some of the barriers to better integrate yoga into cancer care.
Thank you, John.
I might mention a couple of comments I have on other presentations, but I don't want to spend too much time here. Okay?
Please go ahead.
Okay, for example, Karen talked about her research using classes that were 75 minutes. That's a common amount of time for a class, okay? But from a practitioner's or teacher's perspective, typically we will teach people short practices, 15 to 20 minutes that they can do every day or multiple times a week. So from a practical perspective, I'd like to sure there's plenty of support for short practices that people can do. As somebody on this panel used to say, practicing yoga should be like brushing your teeth. Be something that should be done regularly every day. And the other thing I want to mention, perhaps heretical in this group, is the role of protocols for yoga in cancer care for anything. I understand that from a research perspective, but from a practitioner's perspective, teaching lots of individuals, that sort of raises my eyebrow about that. Because there's lots of different ways to practice yoga effectively, even for cancer care. So I just hate to get us locked into certain protocols that might work under certain circumstances when we know different people can teach different approaches to yoga in different environments that are just as effective. Thank you.
Thank you. Before we go to Vadiraj, because John has to probably move to another session, would you like to comment on the importance of the field lagging behind because of lack of intergovernmental effort, or do we need to lobby with the United Nations just like we did for the International Day of Yoga, June 21st? Because there is apparent resistance in the healthcare system by some cancer oncologists not to accommodate yoga as a part of practice, as a part of treatment, or as a part of prevention, at least in some countries. Would you like to endorse a declaration or a statement saying that we urge the United Nations to adopt a resolution for integrative health, including yoga and Ayurveda, for adoption as a resolution?
Who was that question?
I will. This is to you because you have to go to another session.
Oh, yes, I like that. But I want to note one thing. Our IYT has been working with the Society for Integrative Oncology to better present the effectiveness of yoga in cancer care and all those things that are required. So the cooperative effort that the practicing yoga therapists are doing with the practical oncologist is important for that. And as that work develops, we'll be better to make more public recommendations, like you're saying, given the collaborative relationship between the yoga practitioners and the practicing oncologist. Make sense?
Sure. So we'll how much time do you have for this to move to the next session? Are you going to join us for a brief discussion before we go to the public to take questions from them?
I'm supposed to leave now, actually. I can stay a couple of minutes, but I'm supposed to leave here.
Okay, so as long as you can stay is okay. And then let's see what Dr. Vadiraj has to say. He's working with Dr. Raghavendra Rao in the CCRYN, Ministry of Ayush, and is the real engine behind Dr. Raghavendra Rao, who is spearheading the yoga mission. Dr. Vadiraj, you have any comments to make or your thoughts to share on any of what all of us have mentioned and talked about?
Yeah. Thank you very much for inviting me here. So far, we have heard many things. I just like to say some of the points. See, when we started cancer research, probably the Raghavendra is the first one who started in India, the cancer research. We had a lot of obstacles. The oncologists were not even ready to accept yoga as one of the intervention in the oncology setup. And somehow he came up all these barriers, and then we had lots of design issues, and then he overcome all those things, and we meticulously designed these randomized controlled trials, and we have conducted a lot of studies, and so on and so forth. Throughout the world, they have conducted many studies, and we have now have the evidence to show that yes, yoga is very, very useful, not only in managing the symptoms of these cancer patients, and also we have shown the improvement at the biomarkers and even the salivary cortisol level, DNA damage, so on and so forth. But Dr. Satbir Khalsa once again say that when it comes to the translational issue or making a policy, from the yogic perspective, we have certain domains which needs to be addressed before making it as a policy. And because these are the questions which are again and again raised to clarify, to make it as a policy for including yoga in the oncology intervention. See, when it comes to the yoga perspective, like we have certain domains like the style of yoga, the dose and delivery of yoga, components of the yoga intervention, specific class sequences, dealing with the modifications, selection of instructors, facilitation of home practice, and measurement of interventional fidelity over time. All these are the issues. We'll just see what all these things. So when we comes to the style of yoga, in India, we know that we have different lineages of yogic schools. We have Patanjali Yoga, we have Swami Vivekananda's Yoga, we have Pattabhi Joy's Yoga, Hatha Yoga, Vinyasa Yoga, so on and so forth. So when it comes to the policy, they ask, what is this? Which one you are adopting? Then the dose of yoga which comes. So just now we were discussing that the dose of yoga, that means how many hours of yoga per day is required when it comes to a policy making. Because a lot of studies which have shown that from 15 minutes to a 1 hour per day yogic intervention. So this is a problem. Then frequency of practice per week. Some studies have shown that 2 sessions per week, 1 session per week, and everyday sessions per week, so on and so forth. And how long should be the intervention? Is it for 3 months? Because one recent review article said that at least the minimum 3 months intervention is able to show some changes. So what should be the interventional duration? And how many sessions we are supposed to teach them through supervision, and how many sessions they have to practice at home, how to monitor all these things. These are some of the problems. Then once again, when we come to the components of the yoga, you know, in yoga, we have so many components, starting from kriyas, asanas, pranayama, bandha, mudra, relaxation techniques, meditation practices, counseling, which is very, very important, which is missing in so many other yoga interventional studies, especially in the West. So these are some of the challenges. Then the specific sequences of the classes, how to start the yoga sessions, whether it should be started with loosening exercises, asanas, then pranayama, relaxation, then meditation, or starting with the meditation, then relaxation, then comes to the pranayama, so on and so forth. These are the issues we are facing. Then when it comes to the modifications, where suppose a patient is undergoing a chemotherapy or something where they have lot of fatigue, where they are not able to do any of these physical practices, then how to bring a modification in this? Whether this modification is allowed as per the classical yoga text, or can we bring this modification like chair yoga practices, so on and so forth issues. Then when it comes to the instructors, again, just now we were discussing that also. We have so many yoga schools training them, but which one to adapt? We have Kaivalya Dhama, a different way of training the instructors. Yes Vyasa, different way of training. Patanjali Yoga Peeth, Moraji Desai National Institute of Yoga, Iyengar School of Yoga, Yoga Mandiram Chennai, so on and so forth. These are the traditional yoga schools, and they have their own traditional teaching practices. But which one to adopt? That's what Dr. Raghavendra was saying. The educational practices, are they competent enough? Are they trained enough to train these oncology patients? And if they face any complications, how to deal with all these things? So these are some of the challenges which we have. And we say that most of the studies have said that only 2 sessions per week as supervised yoga classes, and rest of the things were asked to do at home. Are they actually practicing at home? We don't know. And how to monitor those things. So luckily we have come out with some of the things like preparing a CD and giving to them so that they'll be able to see that CDs and practice that. Then maintaining a diary so that they can record whatever they have practiced. But still we are not sure whether they have practiced it or not. And at the end, concluding that some of the studies shows that yes, there is no significant role of yoga. but we are not sure whether they have practiced yoga or not at all. So we will not be able to conclude just by that one. Then the other issue is, though we are using different yogic practices, but when it comes to the policy matter, they ask what is the references for all these yogic practices. Are these yogic practices mentioned in the classical text, which shows that yes, there is a role of these particular yogic practices in the management of these oncological cases, so on and so forth. So these are certain of the issues which we have to overcome all these things, then only we will be able to make it as a policy matter. So in that way, the CCRYN is working, and we are trying to come out with all these things and trying to bring a standards in training, especially the yoga instructors for oncology care, so on and so forth. Hopefully, we will be able to overcome all these things, and then only a question comes of making it as a policy for oncology practice.
Thank you very much.
Thank you.
Thank you. Thank you, Dr. Vadiraj, for very pertinent points. They're very valid. And I think the CCR1 may consider working with the India Yoga Association, which encompasses all the schools that you mentioned, Asvyasa, Kaivalyadham, Patanjali, and all of them, along with, in tandem with the John Kepner's IAYT, to troubleshoot these problems of frequency, compliance. Although DOSI app that Raghavendra Rao always often mentions can help you know what is the compliance and adherence, and the yoga mats also that he mentioned. But I think these have to be taken up at the IIYT and the IYA level, and come up with, and that is also important, as you mentioned, for the standardization of protocol. And this also answers the question that is just there in the chat box among one of our attendees, Dr. Bura, mentioning, I'm exhausted by my daily data. My only comment is, instead of working on public policy, individual policy will make sense and easy. Focus on awareness, create hobby, introspect, yoga, challenge, all that. So I think that all is only possible if as you said, there are different kinds of yoga. There are different, we do not know the frequency, we do not know the compliance. So all that has to be put on in a form of a protocol. And I'm sure Dr. Kepner will agree here. Unless we have a protocol, and of course it can change and you can customize it. You can customize based on psychometric analysis. You know, we have Triguna and Tridoshas, or you can develop more kinds of customizations based on other prakriti and other formats of human behavior. And I think protocol still is required, not only from the standpoint of research, but also from the point of view of quality audit. And therefore, this is something that is already being taken up by you, as you mentioned, Dr. Vadiraj. So if there are more comments from any of the panelists, we can now discuss.
I have a comment on this.
Yeah.
I want to make further comment on what Dr. Vadiraj had told. This is very important because we're talking about cancer patients, we're talking about oncology patients here. And in the last year, myself and Dr. Santosh Rao also had a discussion on this. We deliberated more on this, and we also felt there should be a need for a training curriculum framework to train yoga therapists to handle cancer patients. Why I say this is because cancer is a difficult ball game. It's a different game altogether compared to other parts, other NCDs like heart disease, diabetes, back pain, musculoskeletal problems, etc. This is because the amount of treatments which cancer patients receive, the amount of debilitating side effects which these people have, it's very difficult. It's a very important challenge. And only somebody with a know-how and understanding of medicine, and also not just medicine, but know-how and understanding about the psycho-oncology, our understanding about all the problems which the patients go through, understanding about the complications of medicines, etc., is very important. For example, if you have a patient with cancer and also has bone metastasis, okay, or if the patient has cancer and she's on aromatase inhibitor therapies, okay. If this is the case, over a long period of time, they can lead to osteoporosis and they can lead to pathological fractures if you start doing a lot of stretching exercises and acute bends and etc. in yoga. So a lot of caution has to be taken based on the condition of the patient. So are yoga therapists competent enough to assess this condition of the patients? I don't think so. So what is important now, we feel, is to have a proper curriculum framework where we can train somebody in oncology. And this is a very, very important aspect. I think we are not given a thought to this. We've been using yoga. What has happened here is all the research which is happening. We are just talking about certain measures like improvement in sleep, improvement in fatigue. And these people are often in research already triaged, already examined by the doctors. And once they are found to be safe to undergo the yoga intervention, they're put into the yoga trial. But when you talk about practice here, it's not the same way. You have patients who come to you saying that I want to do yoga intervention. And there, this assessment is very, very important. And if you don't know how to assess a patient, if you don't know about the medications that the patients are taking, if you don't know about the side effects, if you don't know about psycho-oncology issues, if you don't know about clinical issues, it is very difficult and sometimes even dangerous to endanger some patients. A simple example I can give you. A few years back, there was a death of a patient who was doing yoga. She was an obese patient, was on fasting therapy, was doing dynamic yoga on a mat. She fell backwards while doing fast jogging because her yoga instructor did not tell her that she has to be cautious. When she fell back on her neck, she broke her atlas and axis, cervical bone, and she died instantly. Okay, this is one of the first effects and side effects of yoga. Now, cancer patients have severe electrolyte disturbances because of nausea, vomiting, diarrhea, and also because of the treatments they take. Okay, when they have low sodium levels, when they practice dynamic yoga, when they practice losing exercises, they can have a fall. So all these are very, very important aspects which somebody has to really understand. And I don't think somebody with a MA, MSc yoga or a BSc yoga or somebody with a postgraduate diploma done somewhere in some school or some any other school of yoga, thought of yoga like Patanjali yoga it may be or SVRC yoga will not be able to teach this kind of thing. So this sort of a setup, this sort of a curriculum framework, this sort of training has to happen in association with the oncology setup or an oncology hospital. Otherwise, the kind of training which we give for yoga therapists on oncology is very, very poor. And I think unless that is corrected, it's very, very difficult to progress, trying to see that we do a justice to yoga practice in oncology.
And the National Education Policy, Dr. Raghavendra, provides us the framework, the substrate for us to develop health education curricula for the integration with the MBBS or the medical undergraduates or the postgraduates, so that they're not just MSc yoga, MA yogas, but they're already advanced into a medical degree. And if we can integrate this aspect to their own study and curricula, maybe they can manage this better. What do you think? Is this the answer? Is the national education policy an answer? And can we have a similar policy, a kind of an intergovernmental thing to be rolled out, which is too ambitious, but since it's an international forum, so we can
when
even
you talk about, I think when you talk about integrative medicine, this policy itself is very, very good because it helps in encouraging integrative medicine practices. And this has to occur both ways. So it's not just with allopathy taking to take over Ayush medicines. It also has to be Ayush medicines taking to take over with allopathy as well. So both of them have to be hand in glove in management of a patient. But we should have our own set boundaries, know where we have to stop, where they have to take over. They know where they have to stop, where we have to take over. So unless that boundaries are really defined, it becomes very, very difficult to really regulate it in a correct perspective.
And that is correct. And I think we can take some, although we have our own courses, John Kaplan mentioned some diploma courses and some professional degrees that he mentioned. Maybe through this platform, through the National Education Policy Framework, after doing it with the correct boundaries which you just now mentioned, similar things can be emulated by IIT or the other international organizations for implementation in their respective countries. And I think the tele-yoga, which Dr. Vaidya just now alluded to, and others are, of course, welcome to also comment and cross.
Yeah, I'd like to make a few comments on Dr. Raj's comments, Dr. Raj's comments, if possible.
Sure, please go ahead. We have 2-3 minutes before we go with the general public who are waiting for asking us some questions.
So I think the issues he was raising with respect to the yoga research for cancer is applicable not just to cancer patients, but for yoga for all conditions. The field of yoga research is really very much in its infancy. And right now, the clinical trials are basically trying to determine whether there's any kind of hope for efficacy at all. That's the focus. And what we need in the future is we need to understand what components of yoga, what styles of yoga provide the best intervention provide the greatest degree of efficacy. We also need to know dose response curves, just in the same way as pharmaceutical research is. We need to know what the dose of research is. How much do you need to practice? For how many weeks? How many times per day? How long per day? So these are all issues that are essential. But right now we're, as I say, we're in the beginning of this field. And so we're just starting to see that yoga has some hope for efficacy. And in defense of the heterogeneous trials that we have, it's true that we have many different yoga styles that have been studied. However, there is a common core to all of these practices. Most of the yoga interventions in these studies do incorporate asana, pranayama, relaxation, and meditation. And so there is a basis there for commonality. And I think it's fair to combine these different studies together to make a policy statement, at least a preliminary one. Until we have more information on what are the best specific practices for cancer patients and what is the best type of dosing.
So we can include that. Can we include that in a consensus statement from today's discussion? Do we all agree, Dr. Raghavendra? First, that there is a need for multicentric trial and identifying the funding mechanism for that. Number two, the importance of integrative healthcare course curricula, which is beyond MSc, MA yogas, and an ethical responsibility to do that, adherence issues, compliance issues, and what Dr. Sadbir said about deriving at the correct trials and the consensus pranayam, asanas, and the meditation composite protocol.
Yeah, I agree with him completely. Yeah.
So
Okay.
can I follow up with a comment? Do we have time?
We can barely hear you. Can you speak?
Can I follow up with a comment?
Yeah, please go ahead.
So I wanted to follow up on the comment made about yoga not being covered by insurance based on the current existing data.
Yes, that's another thing. Yeah.
So I think, Dr. Sadbir said this field is really in its infancy in terms of research. That could not be more true. That is 100% correct. And really, for something to begin to rise to the level for an insurance company to really want to be able to reimburse that, particularly here in the United States in our healthcare system, you have to have what's called level 1 evidence, and you have to have more than 2 trials. And what that means is you actually have to do a randomized clinical trial. It has to be very large numbers, like 5, 6, 7, 800 participants. And it has to be compared to a rigorous control condition, or what we would sometimes call a behavioral placebo condition, to really rise to that true level 1 evidence. To my knowledge, the trial that we just presented at ASCO back in June is one of the first phase 3 definitive level 1 randomized clinical trials that compared a yoga intervention to a very, very rigorous behavioral placebo condition. We have to do more of those, and we need them to be done in multiple countries, not just in the United States. So
that's a good idea.
If we get those kind of trials, that will really determine efficacy and effectiveness. But that won't be enough for insurance payers to want to pay. That will get yoga raised up to a gold level standard of treatment in our treatment guidelines. But insurers are also going to want to see how having patients do a yoga intervention is actually going to improve the actual healthcare system. So for example, if I do yoga in my cancer survivors and I improve their insomnia and their fatigue and maybe some of their physical function or some of these inflammatory markers, does that mean that eventually they're going to have less symptoms years later, which means they're going to come back to the doctor's office less often, which means as an insurer, that's going to ultimately save me money. I have less visits and I have efficacy for my patients to treat things that need to be treated. I have increased value to the system because I help the patients and I lower the cost that it takes me to cover them for their medical treatments as an insurer. And so there's a whole field of what's called cancer care delivery research. And I have not seen any yoga studies that have included cancer care delivery research outcomes. So, you know, we have many phases to go. There's a ton of work. People are going to be doing this
Great.
long
Thank you
after.
thank you for pointing that out. Maybe we could include a statement saying that we should have multinational trials. How we, Dr. Sadhbir, I haven't come across any single multinational, multicentric trials.
No, certainly not multinational. And I'm not even sure if there's multi-site trials yet in cancer, in yoga for cancer. And it's also variable. I mean, the trials are for different symptoms. There's trials on yoga for fatigue. There's trials on yoga for nausea. There's trials on yoga for stress in cancer patients. So the outcomes are varied as well.
Great. And also with that, the insurance companies, I was just wondering, sitting thinking, I don't know if others have any comment. This might look like a naive question. How will we convince the insurance companies? As she said, and Karen said that we could tell it to them that they visit the hospitals less often, so they would be attractive. It would be attractive for them to put yoga in their insurance cover.
Yeah, so this is cost effectiveness research. We have to show cost effectiveness. We have to show that not only is yoga for cancer efficacious, it also will reduce costs, prolong life, and reduce future visits. I mean, we have very few cost effectiveness trials entirely in the entire field of mind-body medicine. There are very few trials. So this is a big issue in the field of integrative medicine as a whole. We need cost effectiveness trials as well as efficacy trials.
Excellent. Thank you, Karen. Thank you, Sadhbir, for those nice comments. And I think I'm going to write down these comments together. If others, John has left, he had to leave for another meeting. If Dr. Rao or anyone has any other comment to make, I can include this and then circulate this among us. Otherwise, we can just go right away to the question and answer session with the public at large.
Over here, we can see that Josie is asking a question.
Yes, hi, good morning. I have a question on the financing. Can we not create a global funding page among yoga instructors, integrative oncologists, researchers, anybody who has an interest in yoga and cancer prevention, and create a global funding page whereby people can invest however much they can afford, so we can get enough funding to be able to research.
Yeah, that's a good idea. And everybody,
because I, for one, I would be happy to invest in a great project like that. And I think the only way we're going to get financing is by doing a collaborative approach with everybody who is interested in yoga for cancer.
This is the solution question, and we are ready for this answer, and anybody can comment. Just to start the answering, would like to say on October 2, we have Mahatma Gandhi's 151st birthday, and we're doing a grand meeting, a closed door meeting, 12 people, includes Nobel laureates, Prime Minister Office advisors involved in India, and a couple of people in California. And we are just doing that to, we have two philanthropists coming. Microsoft is being represented, and we have Dr. Amit is trying to get the Tatas involved, who are one of the Indian industrialists, to form a corpus fund, and part of that fund is for advocacy, and partly can be used for research. And we're trying to tap up the United Nations to set up 2 centers as a India-USA friendship project, but we can include other countries. Of 2 centers, you are in UK?
Yeah, well, I'm in Singapore now, but yeah, I'm from the UK.
So this is what we were thinking now. The ideas evolve, research is dynamic, and you raise the cost effectiveness thing, and you're there, most welcome. If you're really interested, I would just leave an email and I will contact you. And I'll now let the others speak on this.
Okay, great.
Raghavendra, Dr. Sadhbir, your comments, suggestions.
I think just one comment is that the problem with funding research is that research is extremely expensive, and it's extremely expensive because you're paying for people's salaries. You're paying for the scientists, you're paying for the research coordinators, for the research assistant, and even in many cases for the yoga teachers to do the teaching. And so whenever you're paying salaries, and you're paying these salaries over what is necessarily at least a few years, this amounts to hundreds and hundreds of thousands of dollars. And this is why the majority of research of larger trials really can only be funded by agencies with deep pockets, and this means the federal governments. So in the US, the NIH will fund a trial for, $1.5 million, and that's enough to do a 5-year study. So it's an enormous amount of money, and that's one of the real challenges here. However, you could set up a fund where there are smaller amounts of money that are leveraged to fund projects like pilot projects, to fund graduate students in beginning a project, to fund some supplies, that a project that's already sort of in planning stages that might need a few $1,000s. That's the kind of thing where you can leverage that and make a difference in a study happening as opposed to not happening. So
excellent. So to the person who asked the question, what Dr. Sadbir is saying is to fund the human resource, which bring in the value to research, value to translation. That's an excellent idea. To date, I would like to even urge Dr. Raghavendra Rao to consider that. To date, postdoctoral fellowships for yoga don't exist as of now in Ministry of Ayush. Maybe can we have that kind of? I'm sure you're working on that. And to this lady, sorry I missed your name. We should, because you flagged the issue of cost effectiveness. So we are all ready for that. You be there. You come forward, and we'll talk it out. And Dr. Raghavendra, you want to tell anything? Please.
Okay. So I think there's already some. I think Karen can tell you more about it. I think she's already up with fundraising programs for research.
Oh, really? Wow.
Yeah.
Karen.
So I can speak a little bit to the funding. Dr. Sadbir was exactly right. So I've conducted 2 large nationwide clinical trials in the United States, one with 410 survivors. My most recent one we just completed had 720. We've done a multi-site trial, so we have over 25 sites across the country that have worked with us to do these trials. Just to give you an idea, both of those trials cost me over $6 million to do them. And I leveraged 2 other funding sources that are different, that are funded, 2 networks that were also had funding in addition to that. So I would say if you guys want to start funding programs, he was perfectly right about a pilot study, because you need good, strong pilot studies from your really smart junior people who are wanting to do this work, and they're never going to be able in their career to get a 1.5 or $5 million grant if they don't have that great pilot data. The other thing that you can think about funding, and sometimes small amounts can be given to universities and organizations where you can create an endowed account that would be big enough to fund a graduate student assistantship, or like they mentioned, a postdoctoral fellowship. And it's not just a one-time deal. If you could get enough money to be able to fund that in perpetuity off an endowed account, that would be a tremendous contribution, because that would mean now that you'd always have something there for junior people coming forward to launch their careers in this research area and to do this work. We need a ton of that everywhere, in every country. More of that would be helpful.
Thank you, Karen. Thank you. So maybe we can move to the next question if any of the panel has no other comments to make. And thank you for that question. Please leave your email, the lady from the UK.
Hi, Dr. Akshay. And hi. It's not so much a question that I've raised my hand for. It's a combination of a series of comments to the panel, as well as to Karen specifically. So I come from a corporate insurance background, and I've been in the direct side, I've been in the reinsurance side, and I've done regional work. It's really very true that a lot of data is needed before an insurer would be interested in looking at something. However, insurers are always interested in looking at cost savings. And they're also interested in potentially funding certain research work if they're going to be, if they're going to, if it's going to reduce their bottom line expenditure. And cancer being something that's taking up a lot of money in terms of payouts would be something that they could potentially be interested in. Having said that, it's a combination of grassroots involvement as well as top-down. And typically what happens internally within organizations like that is it requires somebody who's interested in something to then take it to the next level and to raise it as a topic of interest for the board of directors, for that particular organization to think about and consider taking it to the next level. So what we've been discussing here so far, what I've been hearing you guys talk about is a lot of high level collaboration. And it would be great if something could be extended to the insurers, because they could save a ton of money as well in the long term. Because I have seen money being set aside funding projects not related to specifically cancer, but other aspects of healthcare. So
thank you, Bhuvan.
just sharing some thoughts.
Yeah, thank you. Maybe Karen wants to react to that. You raised the insurance issue, Sabir raised the insurance issue. Any comment? We take that very nicely.
I would say also that the American system of insurance is very, very different. It's a huge wheel over there. It pretty much runs the whole society. Out here in Asia, it's a little bit less. However, healthcare is still very important. And each region has a level of autonomy. So regions are allowed to do certain things before they then come together at the global level.
Thank you, Bhuvan. Let's hear what Dr. Sabir has to say.
So I think this is an issue in many healthcare systems, but it depends upon the nature of the healthcare system. In the US, we have a multi-payer system, which is causing a lot of difficulty. But in a single payer system like in the UK, there's much more incentive to save money. And I think what we really need in modern medicine, we have this acute care model that we're waiting till diseases occur and then we're spending money to treat them. And this is ignoring prevention, because 88% in the US of all healthcare costs are for preventable non-communicable diseases, including cancer. As I mentioned, up to 50% of cancer is preventable due to lifestyle issues. So if we have a single payer system, the way that can be an incentive for insurance companies is if they encourage their healthy clients to practice yoga, it's likely that they will avoid a lot of these lifestyle related diseases, not just cancer, but also type 2 diabetes, obesity, and hypertension, as well as mental health conditions like depression. So I think prevention is really a powerful way for yoga to make a huge difference in the medical system. One of the studies that I've been doing is focusing on yoga in schools. I believe that yoga should be part of everyone's lifestyle. We should incorporate yoga in all of our schools, because our schools don't have any strategies for managing stress, managing emotion, and that translates into behavior. So I think that's really the best way to really save money overall. And if healthcare companies can invest in having their clients, encouraging their clients to practice yoga, they're going to benefit financially over the long term.
Do you think we can? Yeah, go ahead, Bhuvan.
Sorry, I just wanted to add on a couple more points. A similar, well, last year, the Singapore government came out with an article, well, in collaboration with the local publication, to say that they were concerned at the amount of funding that was going towards hospitals and tests, where a lot of patients were going in there complaining of issues, but then running a whole suite of tests, at the end of which was an inconclusive result that couldn't identify what the condition was, what was wrong. And the government has a suspicion that it has to be related to stress. However, going back to what Dr. Sabir was saying about introducing yoga in school, the government is also very concerned about racial harmony. And yoga is still misperceived as a religious activity because of its roots in India and because of association with Hinduism. And so for that reason, yoga in schools has not been introduced, because nobody wants to stir up a potential sort of unhappiness, potentially.
Yeah, but if you look at, Bhuvan, if you remember, if you're looking at Dr. Sabir's slides, you know, he showed a particular Indian Cancer Society itself not projecting yoga, and as instead calling it by mindfulness, and he objected to that. And there are definitely challenges in, you know, kind of highlighting the secular credentials of yoga, which are indeed there because yoga actually pre-existed the the formal encapsulation of Hinduism. So it was
True.
before that. But yes,
I think it's important, and this raises the issue of education. We need to educate the public that yoga is not a religion. It is not belief-based. It is a mind-body practice. These are behavioral interventions. You move your body, you stretch your body, you breathe, you relax your body, and you focus your attention. That's what yoga is. There's no religious activity inherent in that. And we need to educate the public that yoga is not a religion. On the other extreme, we also need to educate the public that yoga is not just asanas. It's not just a form of exercise. It has many other benefits and many other components.
Yeah, thank you for that clarification. I would like to take this comment a little further to ask Dr. Raghavendra. Are you collaborating with the insurance companies? The pertinent point here was to engage the insurance companies, to make them the stakeholder. Can they fund our Indian CCRYN, or for that matter, Singaporean or American, anywhere? But because Dr. Raghavendra represents Ministry of Ayush or Vadiraj, would you like to comment if you are collaborating and trying to engage the insurance companies in India?
So Akshay, just to put it in more clarity, as Dr. Karen said, first thing is to have a good, robust evidence to say that our yoga intervention is going to be very, very useful. It will reduce the number of, it will improve the cancer care delivery outcomes, such as reduce the hospital visits, better symptom management, improve survival, reduce morbidity, and so on. Okay. And in fact, we did try the same thing when I was there at Healthcare Global Enterprises with Star Health Insurance. Okay. So we had done some work with breast cancer patients, and we had a very huge number of breast cancer patients in our hospital, more than 10,000 and plus patients were all followed up for the next 5 years. Some of them also had received yoga intervention. And we were also talking about saying that with good integrative best practice care, we are having a better outcome, so the lesser hospital visits, etc. The thing here in India is insurance works on the logic that if 10 people are giving their premium amount, you would probably have 1% claim in insurance. So there is some amount of profit business angle to every insurance, and they would not get into any framework where, for example, if you already have a cancer, and if you want to try to claim insurance, you will never get insurance in India. Okay, the moment you're claiming the insurance for cancer, some of the insurance companies come to the hospital, try to even look at the records, try to see whether the patient was smoking, was on alcohol, etc. And if you have those conditions, they don't give the insurance. One. Second thing is to show, even though we show that there is a less number of hospital visits, which we did in our exercise for about 2 to 3 years with Star Health Insurance, they did not rely on that. They said, okay, you're shown decrease in number of hospital visits, all your billing data, everything looks good, but what is the guarantee that the patient did not meet the doctor at their own private clinic? Okay, so that is very difficult for us to substantiate or justify in Indian setup, and that these some of the various factors involved by which insurance will probably deny giving insurance
right,
to
but
already the thing.
Right, but with the empirical evidence, with whatever 5,500 publications we have in general, with or without cancer on PubMed, with that empirical evidence, at least it makes sense to argue with them and convince them over a table that the revisits may reduce, so you at least fund the preclinical work. At least.
So what I'll tell you what it is. Actually, we in fact showed the empirical evidence which is already there out in the literature, research, in PubMed, etc. They don't believe that in India. So what they say is, what are your outcomes? So show us your outcomes. Show us how you have done the assessment of your outcomes. So those are more important than just showing empirical data from Western countries. And we don't have large studies in India to show that kind of empirical data. What is done in US is not accepted in India. Okay, so that is again an issue for us.
Well, then the take-home message is that we really need to work on cost-effectiveness research. That is very important for me. At least my take-home message is this very important message. Very nice, good discussion. Dr. Sadhbir, you want to say something else, or shall we move to the next speaker?
No, I agree with the cost effectiveness. I mean, there's one example of cost effectiveness is the Benson Henry Institute for Mind Body Medicine, which has had a mind body clinic for many, many, many years. And they did a cost effectiveness survey of thousands of their patients and showed that their patients, after visits, to mind-body treatments were then accessing less healthcare. They had less healthcare costs, they had better health on the long term. And so these kinds of pragmatic cost effectiveness trials are really critical if you're talking about implementation of yoga in the field of medicine as a whole.
Absolutely. So we have, let's move on with the next question from Vanilla Velmurugan. Please go ahead and ask your question. Vanilla Velmurugan. She raised her hands.
Greetings to all. I'm keep watching this all the 3 days. I was watching all these seminar sections, and I'm a student from Union Yoga. Now the discussion is going about the insurance and the top level, country level integration and other stuff. But my question is based on the education level. I'm a MSc student in yoga. I got 94% in university, first in Karnataka Open University. But after some time, I come to know that there is no further proceedings. I have done my thesis in such particular meditation for 18 days. If we do for 20 minutes, it is increasing our biomagnetism level by 18%. That is proved, scientifically proved, and GD Pro camera. I have taken the aura and I have submitted all the things like that, like me. So many people has done. Once we are talking about the integration and other stuff, I strongly believe that yoga will help us in so many ways. I don't need to explain more well. But how the students, as a student, or the person who wants to progress towards the society in the non-profitable mode, how can they move? Because after my education, I don't know how to do. I was attending all the NET exams. I was clearing, but I'm not in the cream layer. So again, I came back to IT industry. I'm working in reinsurance department now. So these kind of things, how to overcome. If the source is not available after integration also, the quality of people will not be there. That's what my concern. So if there is any particular way the students who are all pursuing their master degree or from whatever the university, at least they will have, at least I have heard that one of our speaker told that, okay, we need, Don Kaspar, he told, we need to have a common platform. Like after you are doing your MA or MSc or advanced diploma, if we have one standard certification or anything, it will be recognized globally. So for that, I'm from India only. So from India, how we can go forward if they are doing in the other countries? Hope I'm clear.
Yeah, so educational avenues in India and abroad. PhD is one. Any other thoughts from any of the panelists?
That's what John Kaspar told. Actually, they are having the different levels of educations, certifications and all. But when it is coming to the certified practitioner level, they have one certification. So whatever it may be the education level, they have to appear for the exam, and then how we are proceeding with the NET exam and NEET exam in our India.
Like a common exam.
Like a common exam. So after doing my MSc, I'm ideal. I cannot utilize my talent. I cannot proceed my research, anything. So what kind of education system can help in this?
Country to country, it may vary. I don't know for Singapore, but for India.
I'm talking about India only because I'm from Bangalore.
Right. So in India, there are many PhD programs. SVS has one. Even Patanjali has another one. Kevalyadham, I think, also have collaborated. Dr. Vadiraj, Dr. Raghavendra.
I believe.
Okay, Doctor.
This is a topic that's very current in India, and there are the federal agency in India that credentials universities has stepped into this, and there are now 70 universities that are offering yoga programs, and so they are coming up with metrics that are required for certification at the federal level for universities to have a yoga course at either the master's or PhD level. So this is in process. It's being decided what the characteristics are and what those criteria are in process. So there are quite a few universities in India that are doing this. In the US, there are there's a couple, literally a couple. What we have is the IAYT, which is doing specifically yoga therapy training programs. These are outside of universities and colleges, but these are separate yoga therapy schools, which then accredit yoga therapists. There is also this movement in India, the whole idea of accrediting yoga therapists. So these are processes that are underway, but certainly are not established yet in India.
Dr. Raghavendra, you wanted to say something?
I have a lot of things to add on to this. See, you need to understand the education system in yoga is threefold. One, you have the education by private players, the ashrams, the so-called ashrams, the local the yoga schools, which have been doing it from several decades. Then you have the recently launched educational programs on yoga for the last 2 decades. That's BA, BSc, MSc yoga, postgrad diploma in yoga. And if you look at the nomenclature itself, is quite different across different universities. Some of them use the word yoga therapy, some of them use the word yoga education, some of them use the word yoga consciousness, some use yoga science. Okay, that is one. And third thing, you have a Bachelor of Naturopathy in Yogic Sciences, which is a 5.5-year course. It's a professional course which is leaning towards therapeutic yoga. Now, when it comes to ethics, it comes to treatment of patients. It's very important that when you try to use yoga and yoga as a system of medicine, it can only be professed by doctors, because doctors are the ones who can really take care of patients. They understand medicine, they understand the patient, they understand the condition, and they know how to use yoga intervention. So this is a very, very important ethical question to ask today, because can somebody who does a university education program, does MSc yoga with no proper leanings on medical, no medical training, with no proper exposure to patients, no clinical training whatsoever, and can they profess yoga therapy for the patients who have some conditions? What if things go wrong? So there's several questions which we need to really answer, because this is like a tinderbox. You know, what is happening is you're trying to do a curriculum framework, you're trying to set in standards, yoga certification board you have, and you tend to have different types of boards. You have the Yoga Alliance there, and you're trying to work out your own kind of standards. But what we are missing here is, when you talk about yoga is fine, yoga for wellness is fine. You want to be healthy, you want to keep others healthy, is fine. But when you want to take yoga a step further to treat patients, that is when the problem comes. Okay, are you a doctor? First of all, they'll ask you whether are you qualified enough to teach to take care of the patient. Do you know what the patient is taking? Do you know what medications he's on? And do you know what is the complications of your yoga intervention? Do you know what is the goal of your care? So these are some important ethical questions which still remains. And unless we sit and deliberate and work on this issue, it's going to be a very big problem in the days to come. So this lady who is also talking is very rightly talking, because she has undergone an MSc program thinking that she could use her MSc knowledge, her skills to take care of patients, but she's not able to do that. Okay, and most of these university programs which talk about yoga, they also need to make the students aware that this is mainly for yoga for wellness, yoga and education. It's for you to pursue yoga in arts, yoga and education, humanities, and so on, and not for therapy. But unfortunately, what's happening is they have some bit of therapy, they have some amount of classes, crash course on therapy, they have small thin booklets on yoga for diabetes, yoga for hypertension. Then they say these are the asanas for diabetes, these are the asanas for hypertension, and that's it. And that's all. There ends the yoga as a therapy. So that kind of ineffective and ineffective course material, as well as ineffective training, can only do more harm to our system than do anything good. So unless we try to buck up this system, unless we try to agree on certain standards, correct standards, it's very, very difficult to take yoga as a therapy, for a therapy mainstream.
Yeah, that's a very detailed answer, but can you tell her what she can do?
Can I add one more thing to Dr. Raghavendra's comments?
Yeah.
See, in India, most of the universities are offering MSc degree, but we don't know whether it is for MSc yoga therapy or it is for a yoga education. And second thing is, many are doing their dissertation or their course curriculum, but none of them have been exposed to this patient community. Maybe they would have taught some yoga practices for some diabetes or hypertension or cardiac disorders and so on and so forth. But to what different extent, the different levels of these patients' exposures, maybe like the diabetes when they are under control, or diabetes when it is not under control, when it is a fresh case of diabetes, or it is a long-standing diabetes mellitus. So these are the trainings which are missing in their curriculum. So unless and until they incorporate these things and made it compulsory that if they are doing MSc yoga therapy, it should be attached to a medical hospital under a good physician's control. So then only they will be able to train properly. Otherwise, they claim that they are yoga therapists, but they will not have any of these ideas. If the complications comes, how to handle these things. So these are the issues which needs to be settled down before allowing them to not to the therapeutic avenues.
So thank you, Dr. Vadiraj, Dr. Raghavendra, Dr. Sadbir. But can we, in one voice, tell her what exactly next step? What can she do now? Can she do PhD? Should she do? You think? Can we give her a solution?
Yeah, because now UGC has come out with a NET examination, and she can clear that NET examination, get into the university, and she can pursue her doctoral degree, and she can even get the scholarship.
When is the next exam for NET Ayush?
Not in the NET Ayush, it is the NET UGC.
UGC.
And that is in December?
No, June month, actually it is postponed to September. This month, still the application modification is going on.
Yeah, do that, look for PhDs and...
Yeah, I have cleared 4 times. All the 4 times I have cleared, but not in the creamy layer.
So, and all the best for now, all the best for now. But you got a good idea.
I'm pursuing here in Union Yoga for therapist in the clinical training I'm involving. I want to tell some message to some of my friends so that they can also continue their education.
And you also got a good message from us how we are working.
Yes, I got
to put the things together, and it will be, I think, another year or 2 things will be in order.
Yeah. Thank you so much.
Thank you, and we can, thanks. And we can take one last question before we close the entire session. If there are any, please, you can ask questions now. That will be the last one.
Josie has raised her hand.
Okay, kindly ask a question. Yes.
Yeah, I really liked the way John Kepner said that yoga should be as routine as brushing your teeth, and I want to know how we get that. How do we get people to just sit on their mat, whether it's for a couple of minutes or 20 minutes, and just make it just as routine as possible? How do we communicate that message to the public?
So different social media, there are different social groups. Ministry of Ayush is working in his own way. Sadbir is working on their own way. But I recommend that you Google 5-minute Ayush protocol. 5 minutes. These are for the beginners who know nothing about yoga. And we actually do it, just Google that. And it pretty much incorporates everything in 5 minutes, just as a primer to yoga.
Yeah, no, but the thing is that I think it's scary for somebody who's never done yoga to start doing an hour every day. And I think by just starting with a couple of minutes, even 2 minutes, just sitting on the mat and being with your body in the mornings is such a powerful thing. And then from then you start working upwards, don't you, as the day goes on, as the month goes on. But we do all need to be doing yoga every single day for whether it's 1-2 minutes or or 10 minutes, just that little something to just be in stillness. But how do we get that message across to the public? That was my thinking.
Well, I think says education. He's going to expand on that. Yes, Dr. Sadbir.
Yeah, absolutely. I think the place for this is in the children. This should be part of our culture. This should be part of our upbringing. We teach children mathematics. We teach them history. We teach them geography. We teach them dental hygiene. We should be teaching them mind-body hygiene, which is yoga practice. So this should be part of the school curriculum. This is where it needs to be, that everyone graduating from school knows how to practice yoga and knows the benefits of it. That's the way you establish a universal culture of practice. It's in the children. And I think that what we need there is research that shows that yoga in the schools is a viable, form of practice. And we have very few studies in yoga in schools research. There's only about 75 studies published. So that's really in its infancy. And we need a lot more research to show that yoga can really serve as something that can be learned in youth and then carried on through adulthood.
Great. Thank you for guiding her. And I have a question to
Can
you.
I add one point to that?
Yes, please. Yes, please.
See, this is the misconception. We always think that yoga means it is something like an external practice. Like we need to spend half an hour, 45 minutes, 1 hour to do different practices. But it's more than that. It's a way of life. The way how we adopt in our daily routine. The simple thing is just yamas and niyamas we have to adopt. So that itself is a yoga. We need to know how to respect the elders. We need to know how to live with love with others, with gratitude. These are the the things which we have to adopt ourselves. That itself becomes a yoga. So this should be the transformation. So rather than just doing the asanas, putting the carpet and doing the asanas, pranayama and all these things, more than that, we have to change our behavioral pattern. Means we have to be aware of our own self, how we are reacting. The way means we always say, get up in the early morning. The first of all thing is, if we don't get up in the early morning, and even if we do a yoga, so it doesn't make a change. So first thing is to bring the changes within ourselves by changing our own behavioral practices. That itself becomes a yoga.
So you're basically expanding the definition of yoga. But what a question, Josie's question was to how to make it like a toothbrush thing. So Sadhbir said that make it to the schools, and as they grow up, it will become as you visualize, actual lifestyle change. But my question to Sadhbir, Dr. Sadhbir, is to how to make it happen in schools with the question that the lady had asked just before, that the many governments in the different countries don't even accept it. Because
well, this is the same issue is how do you make yoga for cancer into modern medicine? How do you make yoga into the public schools? And the answer is the same. It's the research. You need the research evidence. You need to show the cost effectiveness. You need to show that you can reduce all of the characteristics that plague our schools, things like academic failure, things like bullying, things like suicide, depression, anxiety, that when you have yoga in the schools as part of the curriculum, that these things are reduced and that children benefit and over the long term. And the research is critical to demonstrate that. And then principals and policymakers will say, we absolutely need to have yoga in schools.
But how many publications do you think we need to get them to schools?
Well, this is an open question. Yeah. I mean, there is a critical mass that's required. We need these large trials. We need the pragmatic trials. And it also depends upon the need. I mean, we have a great need in our adolescents right now. These problems in the schools are huge. 80% of children are at risk for developing a bona fide mental health condition between the ages of 9 and 19. Large survey studies have shown this. So there's a huge burden of mental health problems in our children. And so there's a need here. So perhaps that will reduce the amount of studies that we need to have this implementation because of the urgency here. But it does take a critical mass of studies, and it does take translation. It does take policymakers. It takes organizations. It takes societies to promote and lobby for this. In our federal institutions and policymakers, education policymakers, that will start this implementation. India is doing this simply because, Prime Minister Modi himself is a yoga practitioner. So we have surveys that show 90% of the schools in India have some level of yoga practice. That is not the case in any other country.
But not all. Yeah, thank you for those comments. In fact, yesterday was the Teachers' Day, and we did the similar kind of an interaction between the kids, and we brought in some experts who were actually champions in badminton and but also doing yoga. So this person shared the views, and the kids got influenced and they were inspired. And this kind of interaction also generates awareness. But yes, our education policy provides some way. So are you satisfied, Jessie? I'm sorry if
I just want to finish by saying maybe it's a case of saying that it's yoga for body awareness, breath and relaxation within schools, within other environments where there is a lot of misconceptions around yoga, being a hot, sweaty, there's so many different ideas about it. Maybe it just needs to, and actually it's the three things that Dr. Satyam said, that, yoga class should be about breath, awareness and relaxation. And maybe they are the three things that we need to focus on in terms of putting that message out to
Yeah, sure.
the public.
So each one teach one, you teach one, and we'll teach our people who are in touch with us. And that's how we're going to move forward. Any of the panelists have any comment to make before we close the session? If not, then I would take the opportunity.
Sorry, can I just add on just one last question or suggestion? Make sure
Voice is breaking up. Voice is breaking up. You can type it. I can speak for you. You can type it there.
Take me a while to type it.
We come to close the session with that last answer. I'll continue to thank Dr. Raghavendra Rao, Vadiraj, Kepner, Karen for being there all this along. In US, it must be really late. Must be 10:30, 12 o'clock, almost midnight. Thank you for being with us all this along. Yes, Victoria, are you typing it down?
Yes.
So what I will do, I will put together some of the key points and circulate in this panel. And if you all agree, we'll send it. Now I have the endorsement of Kepner, John Kepner from IOIT, and then take it forward. October 2, we are having this huge meeting, and I would like to invite you all to join us. I will send you formal invitation for that. So the question Victoria asks is, you can all read, no matter how much research is done, there's still going to be a huge gap between researchers and policymakers and general public. One effective tool, however, is media. Excellent. Dr. Vadiraj had to leave. So yes, scientists are in their own silos. The policymakers are in their own silos. How we integrate them, she says, the tool is media, which is now. So that's exactly the way forward. So
I would add one other comment to that.
Yes.
You're exactly right about media, but the other thing that is important is actual patient testimonials. And in the United States, where we have a privatized insurance company, this means that insurance companies are competing for your dollars. So you can shop in the market and you can choose different insurance companies to get your insurance through here in the United States. So if patients want yoga and a particular insurance company is offering something where they can access that yoga, they may be more likely to go to that company to get their insurance in a privatized insurance setting. That's not true in a single payer setting. That's not true for some of our, Medicaid or Medicare patients in our country, but we have a lot of private insurance. So, and it's often insurance companies now that are private are thinking about how to market themselves to patients so that they want to actually use that company for their insurance in our current environment. So that's another piece to think about.
So to engage that and to integrate that with the question of Victoria is for my job to do the next media meeting on bringing top insurance giants to the experts like you and brainstorm this. So this will bring the scientists and yoga practitioners out of their confines of their four walls or the labs and then bring it to the policy level. Does that answer your question, Victoria? If yes, that's what we have for you. And we thank you all the panelists for this excellent interaction, giving your time, and we'll stay connected and take it forward. Thank you very much. Namaste.
Thank you.
Thank you.
Thank you.
Bye. Thank you, Dr. Raghavendra. Thank you, Dr. Vaidya.
You all.